I'm Jay.
I'm Adrian.
And together we are the
Two Crazy Cat Ladies.
I'm gonna cut you.
I think I just peed.
Buckle up. We're back in the closet.
Welcome to another episode of Back in the Closet with the Two Crazy Cat Ladies. Guys, we are very excited because this is officially National Pet Dental Health Month.
Awareness Month.
National Dental Health. It's dental. It's all about dental health this month. And especially for our pets, especially for our cats, of course, here on this podcast at Back in the Closet. So
we're bringing you a very special
We're bringing you our favorite from the get.
This evening.
From the get. On this podcast, we have the natural health doctor. I mean, the natural pet doctor.
It doesn't matter who I am. It's okay.
Dr. Katie Woodley, thank you so much for joining us to give everyone a lot of really cool tips on how to help their cats.
Oh my God.
Dental health at
So
home.
Jay may not actually know who you are this evening.
It's okay. I think I do. That's the most important thing, right?
I'm so glad that you at least know who you are. For everyone who's joining that doesn't joining the podcast, joining the live, and doesn't yet know who you are and how you're changing the world, will you give a short intro?
Yes. So I'm Dr. Katie Woodley, founder, holistic veterinarian of The Natural Pet Doctor. And I have a special interest in gut health and helping pet parents find and heal gut health issues by looking for the root cause and healing through food, natural remedies, and holistic health, and helping people really feel empowered and confident about how they can support their pets, not just treat symptoms.
And this is why we feel so blessed to know you, to call you our friend. You are such a gift to this entire community. Dental health for our cats, girl. Such an epidemic, right?
Yep.
Yep.
The statistics show over 70% of cats will have some form of dental disease by the age of 3, and 93+% of cats will have dental disease by the age of 7, which is just like, it's very sad for us, right? Like we get our babies and we don't usually know that they even have any pain in their mouth until it's really bad.
Yeah, definitely. I mean, cats are so stoic. We've talked about this in the past. They don't like showing pain. And also too, cats are not small dogs, right? And a lot of times it's like, oh, just go and brush their teeth. And it can be really difficult to look in our cats' mouths. It can be even dangerous. And if there's pain, they can bite us and things like that. And unfortunately, a lot of cat parents, we may not go to the vet as frequently to get a physical exam and have an oral exam. So that's also where by the time we see it, it can be really severe. And that's where it can be really expensive too. And a lot of teeth need to be extracted. They can also get autoimmune disease like stomatitis. That can be a severe problem also, where they get lots of gum inflammation. There can be a lot of pain, infection, things like that, resorbed teeth. So cats, they're not small dogs. They are a bit harder to treat potentially, but that's where I hope tonight we can share some really easy tips and tools that can really support cats and cat parents so that you can start implementing maybe 1, 2, even 3 of these things that we're going to talk about from no matter where you're at in the world to really help support the oral health, the ecosystem, gut health, the tissues, help remove tartar, all the things that are really important for improving dental health for cats.
Oh my God, I love
your
so
brain.
much.
I love your brain. I love your passion. Let's start with what's one of your favorite dental hacks?
Well, if we can use like real food, right? That can be one of the easiest ways. And so when I look at, especially with my cats, because I've got 3 cats, so I always have to get creative too. I will be the first to admit I am not brushing my cat's teeth. And there it is. I just don't. There it is. I'm a veterinarian. I don't brush my cat's teeth. There's my confession online. You can all do whatever.
Blackmail her with it.
Blackmail me. It's fine. We're good. I know who I am and I'm okay with it. So But the thing is I'm always looking for what are things that I can either potentially supplement with or use fresh food. And this is where using raw meaty bones can be really helpful. Now, not every cat's going to take to these. So this can sometimes be a trial and error thing. I have 2 cats that are super happy to do this. One cat's like, no, thank you. I don't know what that is. And that is what it is. And that's why we're going to give you a couple other options too. But this is where your chicken wings, a raw meaty chicken wing, or even like a chicken neck, something to gnaw on is really, really important because we want that hassle factor where they're gnawing, they're chewing, they're grinding, that we need that to scrape off the tartar. So we're essentially using that raw meaty bone like a mechanical toothbrush. And if your cat doesn't like chicken, you can definitely use like a dried turkey neck or a dried duck neck. And I have a show and tell with me too, I'm sorry for people not able to see these, but I just wanted to show these are things I actually use for my cats. And I'll rehydrate them. And yes, they are big, but they're nice and gentle. They're safe. My cat is not going to swallow this. And one of my cats, Tico, will sit there and he'll gnaw on it and chew on it. And it's a nice environmental enrichment for him too. So utilizing some of these other things that seem like, oh, I don't know if they like it. This comes in a pack of 3. So, you're not going to waste a ton of money. And also too, if you can find a local butcher or a local farmer, I have clients that have bought like dehydrating machines where they'll actually like dehydrate their own meats and things like that too. So you can actually get really creative with how you support your cats and also too, keep it super cost effective long term.
Yeah.
Can I just say, wait, I'm putting, Pinky, that I'm putting hassle factor.
It's especially really good for the bush cats. So
hassle factor bush cats. There we go.
That's awesome though. I love that you put it that way though, the hassle factor where they're and not only is that something that's really healthy for their mouth, it is engaging their feline instincts. Like cats have one job, to hunt, right? Like that is so much. I mean, that's their one job, but that is so huge for their entire enrichment environment.
Correct.
And so many of our house cats don't actually get that option. Get to exercise that instinct.
Yeah.
So being able to give them something with the hassle factor.
Yeah. Well, and I want to also, for anyone listening or watching here, I want to do, I also, because Super Bowl Sunday is coming up, right? I do want to emphasize the fact that they need to be raw, meaty bones. We're not going to get a bunch of chicken wings at our house that we've cooked for ourselves and give it to our cats. We'll be like, oh, that's really good for your cat's teeth. Don't do that.
Do a veterinarian warning on this though. Seriously.
Yes. Don't. So you never want to feed cooked bones. And this is what terrifies most veterinarians, especially like traditional veterinarians, is that they will splinter. They can cause like obstructions, impactions. They're not processed and broken down the same way as a raw meaty bone. Right. So that's really important to keep in mind, and something, Jay, 100%, I'm glad you emphasized. I was going to emphasize it again, because this is where things go wrong, and they go wrong really quickly. And that's where vets will say, oh, raw food is bad. So as long as you're doing it correctly, and also too, if you have a cat that scarfs things, hold on to like the raw chicken wing and just let them chew on it. So that way there's no risk of them just inhaling it and swallowing something whole. Usually with those size things, it's going to be really difficult anyways, because their mouth is so small. But if there's ever hesitation or worry, just hold on to it. You can always wear a glove if you don't want to touch raw meat. Just make sure you wash your hands, like use common sense around, washing your hands just like you would if you're prepping a chicken breast to cook for yourself. But our cats are made for raw food. They are obligate carnivores. They have the digestive enzymes. They have the type of digestive tract that allows them to pass it safely. Right. So keep that in mind too, that raw food is healthy when we use it appropriately.
Yeah.
I love that we have Judith here in the comments. Judith, I love you so much. We love you so much. And she also said, may want to specify not cooked bones.
Oh, yeah.
Because I
do. Judith,
yeah.
You and I right there.
Yes, thank you. And we can't emphasize that enough. I know that
and it's not going to do
the
same job, right? No. It's not going to do the same job if they're chewing on a cooked bone versus
it'll crumble and splinter. And you don't want that. So just like we don't want to chew cooked bones.
Will think that it's okay to give their cat their leftover chicken wing bones.
Yeah, don't do that. Not okay. Not okay. We're going to just say it one more time, just for everyone in the back. It's not okay to feed cooked bones.
Right.
And the other part of the crowd, my part of the crowd, is like, wait, raw meaty bones? Like, could there be anything more gross? Like, what is the cleanup factor in this,
Yes.
right?
Yes. Yeah.
Is there a point? Do you wait till your cats lose interest? What do you do with the remains?
Yeah. Great question. So what I do is I will rinse it off. If they, obviously some cats will chew and eat a portion of it. So if the majority of it's still there and they're just enjoying like gnawing on it, rinse it off and then put it back in the freezer. So that is fine to do. And then you can bring it back out. If it's a little bit frozen, that's okay. So I don't have any issues with that. If you're concerned and you're like, this stuff freaks me out, salmonella, foodborne pathogens, all these things, just throw it away and then have another one. Like typically what I will do if I'm defrosting and thawing like a bag of something is I will just remove what I'm going to use over a couple days. And so that way, if I want to throw something away or the cat's not interested anymore, I have like another one for the next day and another one for the next day. And then I repeat that process. So that way, if you're concerned about like thawing, freezing, thawing again, because I know that's a concern too, then just kind of separate them out in little like Ziploc baggies and just do it that way too. You can get super creative with this. All of us are going to have different comfort levels, right? With what we want to use. And you don't have to do this. It's just a way to help support cats in one way, right? With raw, meaty, not cooked bones.
I'm glad that you started with this because I do feel like this dental hack, this one thing that can help dental health specifically, also helps our cats be enriched.
Yeah.
Mentally, physically, like it is really engaging their feline instincts. And you may see, and tell us if you see this with your cats, because I know we've seen it with ours. You may see a different side of your cat come out when they get a raw meaty bone.
Yeah, they enter a different state. Like it's right? And it's something too, if you have a multi-cat household like we both do, is, if you're not sure how they're going to like behave or engage, you can, if there's two of you to like separate out the cats and each give them attention. So it's not just everyone's focusing on one thing and you don't want them to turn or be like have any aggression or anything like that, separate them out and focus on one cat at a time and give them their space. Really, really important. I don't see aggression with my cats, but I do see, especially with Tico, he was living outside before we rescued him, and he's a hunter, and he's definitely eaten some animals outside, right? Like he's very familiar with it. He prefers that. We don't do that, by the way. However, yeah, not on purpose. So his eyes, you can see it in his eyes. He just is like in the state of glory when he is chewing on like a raw, meaty bone. And that's what they're made to do. Yeah. And so definitely giving them that satisfaction. And this is also where, we can go deeper, like the prey, like whole prey is another thing. People are like, okay, we're done. However, yeah, we've talked about this. I haven't used this in a while, but you can get mice, you can get rats, you can feed that to them. Obviously dead. We're not talking about feeding live prey to them. That's really important.
There are people that do that.
There are, and that's fine. I'm not going to lie. Tico has gotten some animals when he's, just like a cat. If a mouse gets in your house and you have cats, that mouse is probably not going to last very long, right? This is what they're bred and made to do. However, that is the perfect size for them to chew on. Once again, that hassle factor, they're going to chomp, they're going to chew on it. It's going to grind that tartar, and it makes a huge difference. That is the thing I know specifically looking at my cat's mouth and seeing tartar build up, especially in the back, like premolars, molars. After he chews on something like that, his teeth are noticeably cleaner. It's amazing. It's a natural toothbrush.
Yeah. It does make a big difference. And I really do. Our Panthers, and you have black cats as well. Our Panthers are crazy hunters. So when we do give them something like that, they will literally grab it and then they go and find their own solitary place to enjoy.
And then when the other cats come up, it's
we haven't had any violent aggression.
They don't like
Yeah,
fight.
but they let them know it's theirs, right? Like that's normal, you know. If I have something tasty, I might growl at Ryan, you know, stay away.
I do that with Jay sometimes.
I know, right? Like, no, this is mine. You have yours over there. So
I hope I'm not going to slaughter this name here. And I absolutely love you. I've seen some of your content. I believe it's Paola.
Paola, she's
Paola.
amazing. I know Paola very well.
Okay,
Oh,
so we have
yay.
a shared love. She also said Silvervine Sticks are
Yes.
awesome.
Silvervine sticks are another awesome thing. So a lot of cats. So what's interesting about 30 to 50% of cats, they're actually immune to like catnip, right? You put it down, they don't know what's happening. Whereas Silvervine is a little bit different and it's stimulating different receptors with the cats. And about 80% of cats will respond to this. Now, so Silvervine, they're like twigs. So what's really neat is you can put down these twigs, you can play with them, you can hold on to it. And a lot of times the cat will come up and just start chewing on it. And so once again, environmental enrichment, my cats will like bat it under like rugs and like their ripple rug and a mat and things like that. And we'll pull it out and they'll chew on it. So once again, you're getting that kind of like grinding action where they're gnawing at it. I always recommend supervised time, right? We don't know what cats will do if they bite it off. I've never had that personal experience with my own cats, but Silvervine is another really good, helpful dental option for cats anywhere in the world.
Yep.
So one of the things too, I do want to mention, so I always look for organic. So source organic too, just because of like chemicals, you don't know what might be sprayed on it. So there's plenty of organic brands out there, but look for organic.
Yeah. And Silvervine is grown in like places like Japan, China.
It's not everywhere.
It's not everywhere, but it's grown in like these other places that might be actually for some of you guys easier to access than us even here in the US.
Yeah.
Okay, so we've got raw meaty bones. We've got Silvervine.
Okay.
What else do you have up your sleeve?
Okay, I have this bag. So I'm going to show this because Moki, my little cerebellar hypoplasia kitty, loves these. These are little dried herrings. So they're like the little whole fish, and I will hold it for him. Maybe he's coming. Do you want one? It'd be like perfect show and tell. And he just gnaws on it, and I hold it, and he chews on it. And Moki's missing some of his teeth because he has cerebellar hypoplasia. They just didn't grow in. It's just got a few issues. But these are great. So using a dried treat also, dried herring, dried mackerel, holding it, letting them chew. The nice thing with these too is it's a natural source of omega-3s. So omega-3s are really important for reducing inflammation. So when we have a lot of dental disease, gum inflammation, stomatitis, we're concerned with the like resorptive lesions, you're seeing any redness along those gums, making sure that we're getting in omega-3s is really important because they're a natural anti-inflammatory. So love dried herring, super easy to use. You don't use, I'd probably use probably one or probably 2 to 3 a week, if that. But Moki usually doesn't go through one of these. It'd probably last half a week to a full week. So that's my personal experience. But these are really good and really like those. So
I also just have to say that anytime you mention one of your cat's names, you almost go into your cat voice.
Moki. Well, if I did my nicknames, I would. So that's Nuggy. Moki is Nuggy.
Nuggy, but
Chico is Eehee, and Kiwi is Iwi. So
it's one of my favorite things about you. We all have our own cat voice.
I know. I no shame. Once again, we're super comfortable here. So
yeah.
We're all
and I would love to see what other nicknames do people have. Drop it in the comments because it makes us so happy.
Please do. Yeah. We all have like multiple names. I don't know. Do dog parents do that too?
We had all sorts of there were
okay. Yeah.
We'll fit at about 17
dog one day. It's going to be the same, I'm sure. But
it'll be the same. It'll be the same.
What was Finn was so integral to starting your journey.
His big one, for some reason, Ryan and I have a weird thing of removing like the first letter of the name. He was Innie.
Innie.
So Innie.
We're like the opposite. We like take off the rest of the name. Like Zero is like Z. Right?
Yeah.
Not Oro.
Oro. Yeah, I don't know if I do Oro. I mean, Moki's nuggy, but he looks like a little round nugget. So, and he moves like a little nugget. He's just the cutest little thing. So,
Oh, Monkey is so
oh,
cute.
and also Nai Nai is also a nickname. Sorry, Nai Nai.
Which one?
Which one?
That's I was gonna say that's Nuggy Moki, aka Moki.
Moki.
I love the names. Thank you everyone for entertaining this and making us all feel a little bit more
Oh my
normal.
God. Thank you so much.
Meow.
Okay, so
Meowsers.
what else do we have? Like, I know that there are more and more resources out there for dental health, specifically for cats. Shout out to Ryer Cat, who made the cat specific toothbrush. And that really does help for people that are bold enough to start that, and they have great content on how to
And if you
get your
start
cat
them young,
comfortable.
do it.
Yes, absolutely. There's nothing that actually just replaces brushing teeth. You know, it's like Dr. Katie King just said just moments ago on a live with Teeth. She was saying how, you know, brushing your cat's teeth or brushing teeth is kind of the gold standard, right? And yet we feel like failures. We can't even, with Annie Bell, Olivia over here, we still can't trim her nails. Like, she is cat through and through. So it's like, oh my God, we get really excited if she just sits near us at some point, right? So when you realize that there's resources out there and that brushing teeth is important, but you feel like you can't do it, don't feel like a failure. I think there's lots of great resources out here, and Dr. Katie is sharing other ways that can help. What else do you have up your sleeve that it can be helpful?
Yeah, and I just want to speak to that too, because you mentioned like we all feel like failures if we can't do like the gold standard of what like veterinarians are always speaking to. And as a veterinarian, like Moki, it is the most stressful thing for him to trim his nails. So if I need to trim his nails, which I do at times, like I literally have to get 2 toenails in. I have to like towel wrap him, try to support him, you know, and it's one of those things like, yes, there's ways to desensitize and support them, but also too, some cats just have a lower tolerance for things, and it's okay. Give yourself grace. Yeah. So you're not a failure, especially if you're here watching this stuff and learning. Oh my goodness, like you're grade A in my books, like A+ for everyone. So you know, give yourself grace. We're all doing the best that we can. And that includes vets. We talk about a lot of these things, and sometimes we can't even do them with our own pets. So, you know, they're goals and things and tools and options, but that's also why I like having lots of tools in my toolbox to pull out, because each cat, each pet is an individual. So keep that in mind. So in terms of, so we talked a lot about like whole food options. This is where, and I do want to touch on, because I love the question about some of the cats that have lost their teeth too. So I do want to touch on that a little bit, because oral health still matters, gum health, and sometimes cats, they have all their teeth removed too, maybe because of stomatitis, and they still may have gum inflammation. Yeah, it may not fully resolve. Sometimes that happens.
It's typically, actually, in our world at least.
It is very common. Yeah, there's like an expectation that, yes, it should, but more than likely it doesn't, because of autoimmune conditions. Gut health is a big concern too. You know, we've talked a lot about gut health in the past. I talk a lot about it. There is an oral gut microbiome connection. So for a cat who is having severe dental disease, or you're having trouble getting on top of it, and you're trying a lot of these things, make sure you're testing the oral microbiome or the gut microbiome. And there are tests you can do if you can do that. If you can't, just use like Teeth, Jane, Adrian, the 2 crazy cat ladies. You can get it from them. You can, like, it's a great product. I use it for my own cats, and that helps the oral microbiome. One of the things that a lot of people don't use, that I've been talking more about and using with a lot of my patients and clients, are peptides. And I wanted to mention it because it's a little bit different. Sometimes it can be a little bit harder to find if you're outside of the States. I am going to name a brand, because there are specific brands that you want to use, because there can be brands out there that aren't doing it properly, right? And we want to make sure, just like with any supplement company, that they're testing, they're sourcing properly, they're making sure that there's not heavy metal contamination, all of those things that are important with supplements. So one specific peptide I wanted to mention is BPC 157. So BPC 157. Now, this is a common peptide, starting to get a lot of like limelight, especially in the human health world. It's being used a lot for like inflammatory bowel disease, acid reflux. And it's actually, so a peptide is, it'll vary, but a peptide is a chain of amino acids. So proteins are made up of peptides, and then peptides, depending on the type of peptide. So BPC 157 is 15 amino acids long. So each different type of peptide will be a different length. What's really neat with these is that they're natural. They're very safe. They can be used alongside any medication, supplementation, and this one can also be given in the food or without food. So it's a natural peptide that's found in like the gastric juice in the stomach. And so what it does, it will actually help like signal to the cell to calm down inflammation, support like regular blood flow, to help heal inflammation in like the gum tissues or in the gut lining. And I love it. It is so well tolerated. I get amazing results with it. It helps support the microbiome. If your cat has leaky gut, if they're prone to like GI upset, vomiting, constipation, IBD, once again, that connection to the oral health. There's tons of studies that also show that it helps reduce dental inflammation too. And so it also supports improving bone loss in the mouth also. So a lot of cats that get resorptive lesions, there's like bone loss, you can get infections, things like that. So BPC is a nice common, or a nice way to support the body, just to help that healing process without having to rely on things like steroids or immunosuppressants. Now, sometimes you might have to use those. I have no problem with like using drugs when they're needed, when appropriate usage. However, if you do, this would be something you can add on to hopefully lower the dose that you have to give.
May I ask a question?
Yes.
Okay, so it's called
BPC. So like B as in boy, P as in Pete, C as in cat, 157. BPC 157.
Is it a powder? Is it a
So what's neat, so I use this with my kitty cats. There's a company in the States called Integrative Peptides, and this one is a liquid. So this is called full body support. So Integrative Peptides. If anyone here is like, I don't know where to find that, just send, I have an entire blog post too on like this specific peptide. But what's nice is it's an oil. And so it's a black currant seed oil. So that's natural anti-inflammatory too. It's combined with 2 other peptides. So there's one that's also an antibacterial peptide, and one that supports and modulates the immune system too. So it's doing multiple things in the body, which is really powerful and helpful for a lot of cats, even for just optimizing health. And so what's nice, they have directions on how to use it too, because it's a cat and dog product. So there's a liquid, but you can also get a capsule form of just BPC that is a pet product also. And you can open the capsule if you need to, but they also have dosing for cats. It's like a capsule a day. You don't have to pill them.
Right.
You know, I'm like, open the capsule, sprinkle it on the food, and away you go. And typically you can use it daily if needed. I always say take a break after 30 days for like a week to allow the body to readjust, and so that it keeps working. It is not the cheapest form. I'm going to just put that out there. This is something, if you're dealing with inflammation or gut health issues like stomatitis, 100% try it if you can. You can always use it to support your cat's joints and things like that too. I used it personally for my knees. I had severe knee pain, went away with BPC. Gone. Like, okay, cool. That's pretty neat. So it's one of those things where, yes, it's on the higher end of cost wise, but you may not need it long term. That's the other thing. So that's the neat thing too. If you can use it for 30 days or 3 months, and then you're like, my cat's great, just come off of it. You don't need to use it anymore.
So it repairs.
It repairs. Yep. So it's basically like helping the body reset.
Will you name the company again? BPC 157 from who?
Integrative Peptides.
Integrative Peptides.
And a personal question, when you said that you used it for your knee, did you use that bottle that you held up that you also used for your cats?
I have human ones, so I use the human one. It's the same thing though. What's ironic too is there's such a wide range of dosages that you can use. So like we used it for, like, my husband has IBD, and we used it for him along with some other peptides. Incredible stuff. And then with myself with knee pain, I just use it's 500 micrograms and followed the dosage that they listed. And it was amazing. A lot of my clients end up using it for themselves because, I mean, as we age and we just destroy our bodies, right? Like I ran a half marathon last year and I was like, cool, I can't walk now. This is great. So, am I going to keep on running, not with this knee pain? So I was like, I'm going to try this, and it improved. Like,
did you just say you ran a half marathon last year?
I did.
But I mean, but by last year,
you mean
like
I did. And so I was able to run one this past weekend. And here's the thing I didn't tell you before this call, 0 knee pain. You know why? Because I take peptides.
Oh,
Isn't that insane? 0 pain. Didn't even think about it. I didn't even notice until I finished the race. And I said to my husband, we were like back at like the house after, and I was like, you know what? I had no pain. Oh my God, this is crazy. So
wow,
it's amazing. It's really neat stuff. Once again, obviously there's other things we can use. You can use other things in combination with this, but with the results that I've seen with so many like cats and dogs with peptides, it's not talked about a lot. And there's so much research about it that it's really important to create more awareness around it, not only for like cats, but also for humans, because we all deserve to live our best lives. Like we shouldn't be in pain. We shouldn't have dental disease and gum, inflammation and oral pain and things like that.
Right.
And so having more tools in your toolbox to pick and choose from is really, really important.
Wow, that's really exceptional. On a personal note, I'm going to say that I just recently saw a study that was done about NSAIDs, like our ibuprofens. And
yeah.
now that is literally, whatever it was, whether it's cramps, whether it's dental pain, that's what you do. You do 400 milligrams every 4 hours, whatever
plus
it is.
ice.
Right, ice. And now there's all this science coming up. It's been out for a long time. In fact, that there's, I was thinking about it because of your knee pain. Like when you have, like I tore my PCL back in college, and it's like you take ibuprofen and how that actually damages.
Yeah. Well, the problem is too, like, once again, drugs have a time and a place. Quality of life is always most important. I always want to put that out there. I'm not against using medications if needed. However, I think most of the time people are reaching for those medications because they don't know about the natural options.
Right.
And so what's really neat is we now have so much research around longevity medicine, and most of those studies are actually done on animals.
Right.
That's the thing. Like, we can actually take that information and we can use it with our dogs and cats because they are also mammals. So this is the neat thing. It's just that there's hesitation because I wasn't taught about this in vet school, right? But it's like, well, if we're going to take the research and apply it, like, yes, let's make our clients aware. Like, this is something that is a little bit more newer, right? Are you comfortable? Okay, cool. Keep me posted. You're in contact with one another. You're following up. You're making sure that it's working. You can tweak and adjust. You can start low with a dosage, but the results have been astronomical. And that's the thing with some of these medications and supplement, or not medications, but your alternatives to medications and supplements. Like, I know you've talked about PEA a lot, palmitoyl ethanolamide. So PEA is another product that helps with pain, but it also helps with repair. And so these are things where it can help with like dental pain, dental repair. The neat thing is you can combine them. That is the beautiful thing about like a true holistic approach, is it's not this or that. How about and that's where like that magic is in the middle, because a lot of times we're expecting a result right away, just like we would if we, popped an ibuprofen and we're like, oh, my headache should be gone in like 5 minutes. And you give like, say, BPC, and you're like, oh, why didn't it go away in like 12 hours? We have to give these things time. But also too, the beautiful thing is when you understand how these things work in the body, you can take multiple different nutraceuticals and supplements and herbs for their different beautiful properties and put them together and allow them to work synergistically to actually heal the body.
Yeah.
But here's the thing. This is where the P's come in. Patience and perseverance are really key. Yes. That is really key with a holistic approach. So we have to like throw out the window that mindset of like things are going to change overnight. And we have to say, okay, I know why I'm using this. This is how it works. I'm going to have patience with this process.
Yep.
That's really, really key.
You are on fire. You are
always
fire.
on fire, Dr. Katie. Like literally.
But this is I love it. I love it tonight. You hit upon a couple things that I think a lot of us have heard for a long time. Silvervine will help with teeth. Raw meaty bones help. Something that they can gnaw on, something that food matters, all the stuff and things. Yeah. Oral microbiome is a big thing. And yes, there are resources like teeth. There are things out there that can help. But then you blow us away with a little peptide talk.
I love peptides. I mean, it changed my life. Like, and no one knows about it. Like, that's the crazy thing to me. And like I said, they are not cheap, but also too, what's really cool is a lot of times you don't need them long-term because they're actually healing the body. That's the cool thing. Like, great, use it for 1 to 3 months, heal like your body, and then remove the factors that are creating resistance to healing. So can we optimize the diet? Can we reduce some of the stressors? You know, how can we improve physical health? How do we support healthy detox? Let's remove some of the chemicals in the house. That is how you maintain optimal health once you restore it.
Well, and just that reminder too, that once you understand the why of what you're doing,
yes,
it's not an overnight change. It's not pop a ibuprofen and you're supposed to be feeling better in 20 minutes. That mindset has done, I think, in so many ways more damage than good, because we just think that that's the easy fix. Back to the peptides, because I know there's lots of questions.
Sorry, I knew I lit it up. Sorry, people.
He's going down the peptide rabbit hole right now.
Well,
Aaron, we've lots of peptide stuff in our community.
I want to ask the question I think all of us are asking, because I'm about to go Google. The name of the company is Integrative Peptides.
Integrative Peptide, yes.
And they make a
and I'll pop in and I can share a link too. But Integrative Peptides. So what I'm seeing people write is correct. So Integrative Peptides. And I have a blog post on peptides too, if you want to check it out. I did a video on it. So if you just go to thenaturalpetdoctor.com or go to my YouTube channel, Dr. Katie Woodley, the Natural Pet Doctor, and you just literally search peptide, it'll pop up. So, but if anyone's having trouble finding it or getting that information, I put some research articles, things like that too, to help people. Just reach out, send me a message. Happy to share those links too, because I know it's a newer area, and I know we just kind of like dropped it, and it's like, bye, good luck with peptides.
Drop it like it's hot. We you have the link in the description here to Dr. Katie Woodley's website, thenaturalpetdoctor.com. So you guys can click on that easily from where we're at right now. Can I ask you just to like finish this up really quickly? There is there's an old myth that continues to
you are not
continues to go around.
But we keep hearing.
Oh, I know what you're gonna ask.
Yeah,
I'm pretty sure.
Keep
yeah, let's go there.
Over and over and over again. And before we finish up here, if we could just get a veterinarian, a beautiful, wonderful, world-renowned veterinarian, proactive veterinarian. Could we get your comment on the comments that we get on social media, which say, my vet told me that I need to feed kibble because it is better for my cat's teeth.
It cleans their teeth
than wet food.
I'm going to say no, that's a myth. So here's the reason why. So kibble. So once again, let's just do a little anatomy physiology lesson with cats. Cats are not like, they don't have the dental structure we do, right? When we look at our mouths, we can move like side by side, right? And we like grind. We're omnivores. We have flat molars, premolars. We're meant to grind and chew plant material. When we look at a cat's mouth, they're not able to move side to side like I just did. They can only move up and down. And when we look at their dental structure, we see like sharp, pointy canines for tearing and chewing. And then their premolars, molars are like this, right? There's no grinding happening. They are meant to tear, chew, swallow meat. And so kibble is over 50% carbohydrates. The problem with that, well, there's multiple issues. We'll just start with the plain and simple one, is that what will happen is that carbohydrate will turn into sugar. So sugar, we don't want a lot of sugar, right? Sugar will create inflammation in the body, oxidative stress. there's also studies that show that high carb diets will actually adversely impact the oral microbiome.
I
We
mean,
will have less diversity in the mouth, which is really bad. And that can also allow overgrowth of pathogenic or bad bacteria that lead to things like dental disease, gum inflammation. So the idea that an animal, dog or cat, is chewing, right? We talked about the hassle factor with like raw meaty bones. I mean, you can watch your cat like chew, they're ripping, they're tearing, they're like getting that meat off. They do not do that with kibble.
Right.
Most cats, you might hear a crunch and a bite every now and then. However, most are swallowing that kibble whole.
Yeah.
And it's doing nothing for their oral microbiome except for adversely impacting it by creating more inflammation in their body, impacting their gut microbiome too, further down, because it's a species inappropriate diet because it's high carb. So there are numerous factors that are happening that are making it harder for your cat to actually achieve optimal dental health. Now, I do want to say something because I hear this all the time is, well, I fed my cats this forever for their whole life and they never had a problem.
We're fine.
Case study of one does not mean it will never create another problem for your cat now or in the future. Also, other cats, here's the problem I see is, unfortunately, and this is where everyone here, we have a duty to change this statistic. Pets are getting sicker. They're not getting healthier. We are here to change that with all this information and being able to implement these tools, because if we continue down this path, our cats are getting sicker. And so if we continue to feed them species inappropriate diet, our next cat may not be as healthy or strong or as resilient. So the chance of them developing things like cancer, autoimmune disease is much higher. We're seeing it with people too. And so that's why this information is really, really important, and to debunk these myths. And the beautiful thing is we have research behind it. So you can take these research articles and share them with your veterinarian, because as a veterinarian, it's really important to empower my clients and people I work with to bring that information to my colleagues. Because as soon as they start seeing more information, the smallest thing that might happen is they'll start going, what's that? They might not change day one, but we need to have them start questioning the system. And that is how the system changes over time. So that's really, really important, is to take this information to your veterinarian, the research articles, all the things you're learning here from Jane, Adrian, from my site, if you choose to follow that, from all the other amazing like integrative holistic practitioners that are out there spreading this information, because that is how we change the system to help our cats.
Yep.
And the bridge building, I love that you shared that bit about communicating with our veterinarians, your colleagues.
Yes.
They are our teammates in giving our cats their best life. Two things I want to say. I'm probably going to forget the second one, but the first one, though, I think a lot of people think that cats have dental disease because they get cavities. As Dr. Katie Woodley just said, there are no flat surfaces on cats' teeth. Fun fact is cats are incapable of developing cavities. No cat can develop a cavity. The dental disease has nothing to do with cavities, which I thought was like, well, wait, then what's the problem, right? Because we think about it from our own species of dental health. Cats are a completely different species. And as promised, I forgot the second thing I was going to say.
I was going to touch on that really quick, because you'll hear from vets, because I've explained it this way too, for full transparency. So like feline oral resorptive lesions, we'll explain it like a cavity, but it's not a cavity.
Yeah.
So that's really important. And I love that you brought that up, Adrian. So those resorptive lesions are also really painful, but a lot of times it comes down to a lot of things we talked about tonight. So that's really, really important too.
Yeah. Oh my God. Okay. So
I'm going to remember that second thing I wanted to ask you as soon as we get off.
Yeah. As soon as we get off, we will.
I'll shoot you a text.
She will. She will remember, but we just want to say thank you so much for kicking off our podcast this month in February for National Pet Dental Health Month Awareness Month thing. We're so grateful, and all the insight that you give, and you are so well spoken. I have said this since the day we met, but I am just like enamored with you in the way that you articulate so well the information. I know everybody else is too, just like the way that you articulate so well, what we need to know as pet parents. So thank you.
I will say this. Yeah. You know how they say that knowledge is power.
Mhm.
And I have to say, you're one of the people that we are so blessed to learn from and with. Your brain knowledge can also be intimidating. And it is from like, I'll like be reading something, all the research papers that are out there, like you shared, like all of this stuff is there for all of us to find as well. But I'm easily overwhelmed by a lot of information, a lot of knowledge. And to Jay's point, you make it so much easier to understand. You make it very digestible. And one of the things I always keep with me that you say is start with one thing.
Mhm.
Information, knowledge doesn't have to be overwhelming. It's just what did you get from something, and what is the one thing that you can do that is empowering, that's proactive.
Yep.
And you're just such a gift to all of us. Thank you, Dr. Katie
Oh,
Woodley.
thank you so much for having me. We are all in this together. We need every single one of us and every single person listening to this podcast, YouTube, all this. We're all needed. So I'm just super grateful I could just be a small part of it. So thank you so much.
Oh,
I love you so
we
much.
love you.
You guys click the link in the description to go to Dr. Katie's blog about peptides. That's exactly where I'm going after this.
And let me know how it goes for your pets and for yourself if you use it.
Free flowing. Oh, you know you'll hear from us. We love you so much.
Yes.
Dr. Katie,
Thank you. Thank you.
We'll see you all very soon. Bye,
Good night,
guys.
everybody.